The month of October is Breast Cancer Awareness Month, but you may not know a lot about the actual disease. Dr. Beth Brady is a surgeon at Hartford Hospital with a specialty in breast surgery, and she's here today to give us some facts about breast cancer that every woman and man should know. Good morning, doctor. Thanks for coming on the show.
Thank you for having me.
We appreciate it. First, let's talk about breast cancer. Anyone is susceptible, correct?
Absolutely. We know that of all the women who get breast cancer, 20% will have a hereditary component. The other 80%, we don't know what the cause is. So you could be the healthiest woman in the world, watch what you eat, exercise, avoid alcohol, do all the right things, and still get breast cancer.
So what are the symptoms, the main symptoms? Because I think most people associate a lump in your breast as a symptom, but what are some other signs?
I think the most important thing we talk about is early detection by mammography.
Okay.
So that's the most important thing, because the earliest form of breast cancer can be demonstrated in a mammography without a mass. So that's a very important thing. The next thing is it's a change in the clinical breast exam. Sometimes it's a discrete mass, sometimes it's a thickening. Sometimes it can be a nipple discharge or a change in the skin of the breast. So there can be a lot of different presentations for breast cancer.
When do you suggest to get a mammogram, and if it's hereditary, should you get it earlier on?
We'll typically say that women should start screening, get their baseline between 35 and 40, but if there's a family history of breast cancer, we take the youngest person in the family, subtract 10 years, and that's when we start to screen those women who are at risk.
If you have a lump in your breast, is there a way to know if it's cancerous or not, or you have to go in and get that checked? Because it could be benign.
Absolutely. You absolutely have to go in. The most common thing when a woman feels a lump would be a cyst. And typically if a woman watches that through a cycle and it goes away, that's fine. But anything that persists, she's got to do the drill. She's got to see her doctor. She's got to get it looked at.
What are the main things we can do to lower our risk, if there are any, that we can, what we eat, exercise?
Well, the American Cancer Society will recommend that women limit their alcohol intake to 1 alcoholic beverage a day. For men, it's 2. We know men can get breast cancer too.
Right.
And other than that, it's the typical things that we think of to be healthy. You want to make sure that you eat vegetables and fruit, that you have fiber in your diet, and that you avoid lots of red meat. So there isn't really a magic diet to avoid breast cancer.
If you don't have health insurance, where can women go to get a mammogram if they need to?
Each program in Connecticut, here in Hartford, we're very lucky to have multidisciplinary breast centers, and if they call Hartford Hospital, you can call the Partnership for Breast Care. They will make arrangements for their mammogram, and the same thing will happen at St. Francis, where they have a multidisciplinary program.
Okay, doctor, thank you so much for coming on the show. And if you guys want more information on breast cancer awareness, please go to our website, ctnow.com. Guys.